As we've mentioned, the Biden administration announced Wednesday it's buying 100 million more doses of the Johnson & Johnson COVID vaccine. It comes as some states lower their age requirements to get vaccinated. In New York, the eligibility age is now 60. In Alaska, it's just 16. Other states are making news not for changes to their COVID vaccine guidelines, but for changes to their COVID restrictions. On Wednesday, Texas lifted its mask mandate and all capacity restrictions, citing improved conditions there. Businesses in the state can still require masks if they choose to. Dr. Julie Morita joins me now. She's the executive vice president of the Robert Wood Johnson Foundation and a former member of the Biden administration's Transition Advisory Board. Doctor, welcome. Thanks very much for being with us. Early last month, you co-wrote an op-ed in USA Today saying vaccine distribution needs a shot of equity and that in many states, quote, an overzealous focus on speed is leaving behind many of those who should be vaccinated most urgently. Doctor, have you seen any progress in bringing equity to the vaccination process? And how might the Johnson & Johnson vaccine play a role in that?
The challenges that we saw early on related to the vaccine had a lot to do with how little resources were actually coming to state and local health departments at the beginning of the vaccine rollout. There just were not enough dollars given to the states so they could hire enough people, actually get their systems up and running quickly. So as a result, their initial efforts were really focused just getting the vaccine out. What we've seen over the past few weeks has really been a clear, intensive effort to really reach the communities who've been hit hardest by the pandemic itself. And so I'm confident that we'll actually see increases in coverage levels among communities of color, low-income communities, the communities that are harder to reach, because there's been a much more focused effort. You can actually see the vaccines arriving in places where people can access them better. So through pharmacies, federally qualified health centers, or pop-up clinics in communities that have traditionally been underserved.
Well, it will take time to get those 100 million Johnson & Johnson vaccines the president talked about today, but the federal government's supply of doses is growing. So, doctor, where are the bottlenecks?
Yeah, it's critical to keep in mind that there's been great progress that's being made. So while there were some bottlenecks that were significant early on, what we're seeing now is that over 2 million doses of vaccines are being administered on a daily basis, which is really a very large number. Almost 20% of the population has received at least one dose of the vaccine, and almost 10% of the population has been fully vaccinated. So we're making huge strides. I think the key thing really is making sure that the systems are easily accessible. So can people not only register online with high-speed internet access, but also can they call up and make a telephone appointment? Are the appointments easily accessible so people can go after hours or on weekends? And do you have to have a car to get the vaccine? So all these things are being taken into consideration so the vaccines can actually become more accessible. So my expectation is that the vaccine acceptance and coverage levels will actually increase dramatically over time.
And Dr. Morita, with the production pace that we're seeing now, is there a chance that we could see a surplus of vaccine supply, and is that necessary?
It's possible there could be extra vaccine that would hit a point where the demand for the vaccine is lower than the actual availability of the vaccine. But in addition to working on vaccinating, getting people vaccinated and making the appointments easy to access, there's a lot of work that's happening within communities to really engage with people who are hesitant or who have questions about the vaccine, aren't quite sure that they want to get the vaccine or they have enough information to make informed decisions. So all of that work is really important to be happening right now so that when the vaccine supply is abundant, that we don't have unused vaccine.
As we mentioned, a number of states are loosening their COVID restrictions this month. What would you say to people who may live in one of those states and who have not been fully vaccinated?
It's concerning that people are lifting up the mask mandates and also, opening up generally for large crowds to gather. I think it's really important to focus in on the fact that the coverage levels that I described in terms of 20% of people having at least one dose and about 10% of people having two doses or being fully vaccinated, those are low percentages. So many people remain at risk for getting sick and getting seriously sick. So wearing the masks, washing your hands, avoiding crowds, keeping socially distanced. Those things are all really critical to do while we're waiting to get vaccinated. And so while the requirements may be lifted, people can still use their own judgment and make the decision to follow those recommendations. And it's appropriate to do so at this point.
All right, Dr. Julie Morita. Dr. Morita, thank you very much.
Thank you.